And there's a new push from the District Attorney's Office to raise awareness about the dangers of opioids. District Attorney Summer Stephan joins us now to explain. Good morning to you.
Good morning.
Now, okay, so this is a big deal. How big of a rise have we seen in opioids in San Diego?
We've had more than triple overdose deaths from fentanyl, especially. It is really alarming, and that's why we are making sure that everyone is aware of this crisis that we're facing. So we went from 2019, we had 152 overdose deaths from fentanyl, to last year, 461. And this year, we're on track to go over 700. These are lives. These are our sons, our daughters, our brothers, sisters. So it is quite alarming.
That's a huge jump from 152 in 2019 to 700 plus this year. Well, so what makes the opioids so addictive, so dangerous?
Opioid is we think of heroin. We've always known heroin was very addictive, but really that's an opioid. And we've had a huge supply. You've seen the lawsuits with the rampant prescription of opioids that has hit our entire nation. Well, those opioids look harmless. They look like a painkiller pill, Oxy, Percocet. But what the cartels and drug dealers are now doing is, in order to cut their costs, they are including fentanyl in it so that they can need to only use just a few grains to give that addictive effect. But what they're really doing is cutting people's lives. So kids think that they are experimenting with a painkiller, but it is so much stronger, 50 times stronger than heroin.
Wow.
And that's why we're seeing this death rate.
And you just mentioned, a fentanyl-laced something or other. Well, 3 comedians overdosed on fentanyl-laced cocaine over the weekend, and this happened in Los Angeles. But I have to ask, what is the DA's office doing to keep these dangerous drugs off our streets?
Well, we are working with the DEA, the U.S. Attorney, and all our partners. We have something that is now being copied. It's called Homicide Team 10. Whenever we have an overdose death, we respond to it like it's a murder, because fentanyl is so poisonous and so deadly. And we track to its source, and we go after the dealers. We bring prosecution, but as you can imagine, this is after the effect, after the damage is done. So we're attacking it from the prosecution end, but we want also prevention. We want families, San Diegans out there, to talk about this issue with their kids, with their neighbors, to understand that experimenting is no longer an option because of fentanyl and how deadly it is.
And you released a new PSA to help with the prevention. Can you tell us a little bit about that?
Yeah, we're very proud of this PSA because it is research-based. It's supposed to, through focus groups, change hearts and minds, the San Diego Opioid Project. And I was also joined by this heroic mother, Carrie, who lost her 20-year-old son, Eric, to a fentanyl overdose. And her message is just so impactful, and it really hits to the heart of everyone out there. This is really preventable. We want our community to be safe and to not use anything that you don't purchase or get at a pharmacy that's prescribed by a doctor. Anything, Adderall, cocaine, like you mentioned, methamphetamine, painkillers, they're all being mixed with fentanyl. So nothing on the street is safe.
So but before I let you go, just quickly, sometimes it can be difficult to talk to family members about this. What do you suggest? How do we talk to them about, no experimenting and how it can be dangerous? What's your suggestion on that?
What I tell parents is to not approach it from a judgment perspective, but to talk to kids about their friends. You don't have to talk to them about them. You can say, you need to be aware, you need to be the voice to help your friends, not get harmed, not get injured. We've had the Chula Vista teenagers recently. We every day we're responding to a really preventable, essentially murder, death.
Wow. Well, District Attorney Stephan, we do thank you for your time. We thank you for the warning so we can talk to our family members appropriately. Thank you so much.
Thank you.